All right, so we've been talking about MVX Plus, this test, and there's going to have a whole wide array of uses. So one use that you can do is you can use this test to test your doctor. So you can get this test done. Let's say you are going through a chronic health issue. Get this test done. Continue with or start the therapies that your doctor's recommending. And then wait about 6 weeks. Repeat this test. Repeat the MVX Plus test. The test is going to tell you, it's going to show you whether or not you, as an organism, you as a mammal, you as a system of physiology and biochemistry, all right? This test is measuring your physiology and your biochemistry. It's going to show you whether or not you have stayed the same, your test has gotten worse, meaning that you have a higher score, or your test has improved, which would mean your score lowers. So let's put some numbers there. Let's say your score is 65. Not the worst, but not the best. Lots of room for improvement, okay? So let's say you score 65. You then follow the recommendations of your doctor. Do that for about 6 weeks. Repeat the test. If you are still at 65, you know that part of what you're doing is it's not moving the needle. It hasn't really touched anything. If your score goes up, you've worsened. If your score goes down, that's the direction that you want, because it means that you are improving. Now, I'm not including in this something to the effects of you have an acute infection and you're taking antibiotics. Obviously, if you have an infection, you got to take care of that infection the best way with what you have available to you. Could be antibiotics, could be herbs, could be supplements. It really just depends. But what I'm talking about here is you've been dealing with a chronic issue for some time. You're trying to find answers. I don't want you to be in this disease management place that conventional medicine puts you in. What I want for you is for you to find the root cause and to address the root cause. That's what the MVX Plus test does. And I can tell you right now, it means that you need to address some underlying fundamental physiologic and biochemistry issues. Oftentimes that begins with your nutrition, it begins with your digestion, and it begins with taking away the insults that have led to the problems that you're currently having. So you have to address all of these. You just can't deal with only the symptoms and expect yourself to get better, okay? So I want you to test, not only yourself, I want you to test your doctor, okay? MVX Plus, test your doctor. Thanks.